Hello, my name is Peri Perkins, and I will be presenting to you the cardiac lung perivascular assessment. I will check my patient's chart, and then I will knock at my patient's door. I will let my patient know nursing, and I will walk in. I will introduce myself to my patient. Hi, I'm Peri Perkins. I'll be your nurse today. And then I will provide privacy, and I will wash my hands, and I will check 2 patient identifiers. Okay. Max, your name, your full name, and your birthday.
Robert Smith, March 31st, 1990.
Okay. Now what brought you in today?
A checkup.
Checkup. Okay. Do you know who our president is?
Donald Trump.
Okay, and you know where you're located right now?
My living room.
Okay, my patient is alert and oriented times 3. Do you mind if I begin my assessment?
No.
Okay. I will check my patient's head. I will check for any lesions, tumors. Okay, my patient hair is nice, thick, and clean, and good for his ethnicity. Okay. My patient temperature is warm and dry. He has nice pink undertones, no scars, and I see no sign of cardiac distress. No extra muscles being used. I'm going to ask that you lay down for me. Okay. Okay. I see no signs of JVD. Okay. So no distension noted. Okay, I'm going to go to my patient's neck. Have you had any pains, tenderness, soreness, stiffness within your neck, moving right to left, up and down?
No.
Okay. Not driving or anything like that?
No.
Okay. Do you mind if I check your neck?
No.
Okay, I'm going to palpate my patient's neck. Any tenderness or soreness?
No.
Okay. No crumpetness noted. My patient's skin from the neck and the anterior chest is and the patient's hair on the neck. On the neck and chest and is symmetric. Bilaterally, nice pink undertones. I just see some scars on your abdomen. Okay, have that been checked out or anything?
Yeah, when I was a kid.
You're a kid, okay. I'm going to check for any edema on the bony prominence on your arms. Okay. Okay, no signs of edema noted. I'm going to check your pulse strength on your carotid artery. Okay, patient's pulse strength is at a 2+ normal. Okay, now I'm going to auscultate your carotid artery. And as I do this, I'll just ask that you take a full breath in, deep in, out, and hold it. And I'll have you do that every time my stethoscope touches your neck, okay? Okay, no signs of bruise. All right, now I'm going to check my patient's lung field. Okay, starting here. This is the 5th. Okay, so it's from here to here. Okay, and I'm just gonna go over, this is the notch here. So this is the aortic, second intercostal space. Second intercostal space. Right sternal border. This is the pulmonic. This is the second intercostal space. Left sternal border. This is the this is the herbs. This is the third intercostal space, left sternal border, and this is the tricuspid. This is the 5th intercostal space, left sternal border, and this is the mitral, the 5th intercostal space, mid-clavicular line. Okay. 5th intercostal space. Okay. All right, and now I'm just going to palpate your lung field. Okay, have you sit up for me. Okay. And now I'm going to auscultate. I'm going to go back to the other side of my stethoscope. Have you breathe in and out. Deep breaths, nice deep breaths. Okay, S1 and S2 is normal. No extra sounds, no sounds of murmurs, no bronchi or crackles. I'm going to check my patient's PMI. If this was a normal, not normal, but if this was a hospital setting, doctor's office or appointment, I would check for a whole minute. But in this time, I don't notice any heaves or lifts noted, so that's good. Okay. All right. I'm going to check my patient's AB diameter. But I actually come here so I can measure. Okay, and follow me around. Okay, my patient's 80 diameter is a 1 to 2, so that's normal. Okay, and then before I go to my posterior, I'll actually check my patient's temperature, which is warm and dry. Nice pink undertones. Have you had any trouble with your anterior chest or anything like that? Huh?
No.
Okay. When you lift, no soreness, no tightness?
No.
Okay. All right, so the only thing, the scars from when you were younger. Okay. I'm going to actually, I see some scarring here too.
Yeah, when I was a kid.
Okay, and I see some tattoos on your arms. Okay, and your lower arm and on your hand actually.
I hurt my foot.
Okay, so that's good.
Mama,
Okay.
I hurt my foot.
All right.
Yeah,
And
my
I'm
foot.
going to switch out my chairs.
Let's switch these chairs.
Turn it this way.
My foot.
All right. Did you follow me on camera? Okay. So I'm gonna have you turn. So like I said, 1 to 2, good. Now I'm going to show you my lung fields. My notch is here. Could you put your head down just a little bit? It's here. Okay. This is C7. Okay. And do the chicken arm for me. Okay. And here is T7. T7, I'm sorry. Okay. 8, 9, 10. So here's my lung field from here to here. I'm going to, have you had any problems with your back?
No.
Lifting, working, I know you work on your feet.
No.
Any back issues or anything like that?
No.
Okay. I see a couple of scars here. Look like they might have been some bumps or something. A couple of scratches. Nice pink undertones. Skin is good for his ethnicity. For our patient's ethnicity. Okay. So I'm going to palpate my patient's lung field. right. And now I'm going to auscultate my patient's lung field. And every time my stethoscope touch you, I'll have you breathe in and breathe back out, okay?
Okay.
Okay, I hear no murmurs, any crackling, any signs of difficulty of breathing, normal. Patient has nice pink skin undertones besides a couple of scarrings and looks like maybe some scars from scratching off bumps. But this was all from when you were younger.
Mm-hmm.
Okay, chicken pox maybe?
Probably.
Okay. Alright, a few scratches. You said no pain within your back. Okay. Okay. So, okay. Now I'm going to go down your back and follow your lung field, and I'm going to have you say 99 every time I stop. Okay?
All right. 99, 99, 99, 99, 99.
Okay, the vibration diminished as I went down my patient's back, so that's good. My inpatient inferior, okay. Okay, I'm gonna have you, going to go to my patient's upper extremities. Like I said, my patient has tattoos on upper and lower arm and as well on the dorsal side of his hand. I'm going to check the radial pulse. I'll turn this way, I like to. Okay, patient's radial pulse is at a 2+, so that's good. I'm going to check your brachial pulse as well. But relax. Okay, my patient's brachial pulse is at a 2+, strong, normal. I'm gonna have you stretch your arms out for me, equally bilaterally. Hold them up for me, okay? Now I'm going to have you squeeze onto my hand and go against me, okay? And then go, okay. Patient's strength is good, intact. Hair is equally bilaterally, right and left on the arm. Patient's Temperature on right and left arm is warm, dry. His skin is good for his ethnicity, and I see no scarring or lesions on the arms, just shoulder. Oh, on your elbow here. Is that
Not when I was young.
when you're younger?
Yeah, all the scars happened when I was a kid.
Okay. All right. Okay, so that's good. Okay, now we're gonna go to your lower extremities. I'm gonna have you lift your legs up for me. Okay, you can bring it back down. I would check the femoral pulse. Okay, I'm gonna check the popliteal pulse. Okay, I'm gonna have you like that. Okay, popliteal pulse is at a 2+, so that's good. I'm also going to check your tibial pulse and your foot. You can come to it if you need to. Okay, your pulse is at a 2+, and I will check your dorsal pedis pulse. Now your other foot. Okay, you're at a 2+. I see a lot of scarrings on your legs. Okay, is that
Yeah, when I was a kid.
okay? Have you had any issues with the scars or the scratches?
No.
Okay. I do see some. Is that eczema on your foot?
Yes.
Okay. Has that been treated? Are you getting something to take that for that?
Yes.
Okay. All right. Now I'm gonna have you close your eyes for me, and I'll and you let me know if you feel softness or something rough. Okay. Okay. Could you lift your feet up for me and let me know which foot and if it's soft or hard?
Right foot soft. Right foot hard. Left foot hard. Left foot soft. Right foot hard. Left foot hard.
Okay. All right. Have you had any issues with your lower extremities?
No.
How about your upper extremities?
No.
No pain, anything?
No.
Okay. All right. So the lower extremities skin is has a nice pink undertone, besides some scarring and eczema on the feet, on the left foot. Pulses are great, upper and lower extremities. Patients have tattoos on his arm, on my patient's arms. Hair is equally throughout the body. Okay, I'm gonna have you turn around again for me. Okay, now I'm gonna go back to the posterior chest, posterior on the back, the lung field from here do the chicken for me again. Okay, from here. Okay. Now, I'm going to have you take a deep breath. Breathe in and breathe out. Okay. All right. My patient breathing is equally, symmetrically. Hair throughout the body, you can turn to patient hair throughout the body is equally bilaterally. Besides scarring, no signs of lesions or masses or tumors throughout the body. The patient's skin throughout the body is nice pink undertones, and throughout his body, his skin is good for his ethnicity. Okay, I'm gonna have you hold your. Alright. Check your cap refills. Okay, for the upper extremities, the fingers, the patient's cap refills filled up at the 3 second pulse. I'll check your feet as well. Okay, same goes for my patient's feet, 3 seconds. So that's good. Blood flow is good. So no pain, no tenderness throughout the body.
No.
Okay. All right. And if this was a real setting, I will have my patient make sure my patient's bed is at a low to the floor, and I will make sure my patient has their call light, and I will ask if my patient need anything, and I will ask the patient if they want the lights off, on, door closed or open, and I will wash my hands, and I will leave the room. And this includes my video for the cardiac, lung, VAS assessment. Thank you.